So we're going to talk today about humanistic therapy. I gave an overview of all the therapies in one lecture, and I want to follow up with focusing on each therapy so that we have clarity on this. In clinical life or on the test, I don't want you to miss out an opportunity to showcase your knowledge base. So hope we can get to the bottom of this. So humanistic theory is a mainly person-centered therapy. This approach is rooted in the belief that individuals are all good and possess an innate capacity of self-healing and growth. So the foundation lies in empowering individuals to achieve their full potential through understanding of themselves and accepting themselves and be authentic. That's the main goal of this therapy or thought process. So, key therapeutic techniques are unconditional positive regard, empathy, and congruence. And when you talk about unconditional positive regard, this principle is about accepting your patients fully without any judgment or condition. It creates a safe place where individuals feel valued and understood, fostering a sense of trust and openness. Imagine a client struggling with self-esteem due to past mistakes. When therapist demonstrates unconditional acceptance, the client feels empowered to confront their challenges and embrace their worth. Now, the second is empathy. In empathy, it requires the therapist to understand deeply the client's experience from their perspectives. It is just not listening, it's beyond that. It involves truly connecting with the client's emotions and feelings. For example, if a patient experience shares their struggles with grief, the therapist might respond in a way which shows that you care and you genuinely understand. If something like it sounds like this loss has left you feel isolated and overwhelmed. So you can use sounds like how the patient might have felt. So you're trying to put yourself in their shoes. That's empathy. Now, when you talk about congruence, this emphasizes therapists' authenticity and transparency in interactions, that you're genuine, don't mask their reactions, and fostering a relationship built on trust. So picture a scenario where a client expresses frustration and a therapist who is congruent might honestly acknowledge, like, I see how difficult this is for you, and I'm here to support you. So those are some things like fall into congruence. So I see how difficult it is for you, and I'm here to support you. That is congruence. So we got like three techniques: unconditional positive regard, empathy, and congruence. Now let's go to path to self-actualizations and what this means. So path to self-actualization um, aims humanistic theory aims to guide clients on a journey to self-actualization, a state where individuals achieve their full potential. So achieving your full potential is what self-actualization means, and it unfolds in dimensions. So what is, like, you have strong self-awareness, your acceptance of self, deep appreciation of life, focus on meaningful relationships. And the growth process includes exploring thoughts and emotions and awareness of patterns and causes, like identify recurring patterns which happen in life, actions aligned with values. So therapist encourages the client to make decisions that reflect their personal values. So continuous development means like your journey doesn't stop, it's a lifelong learning and evolving. So humanistic therapy has many applications. It can be used in anxiety, relationship issues, personal growth, self-esteem development, and life transitions. And it mainly gives you a better self-understanding, and improved emotional awareness, better coping mechanisms, stronger relationship, and lasting personal growth. Okay, so to review, you want to understand that it's a person-centered therapy, and there are key techniques which are unconditional positive regard, empathy, and congruence. And you want to know what self-actualization is. That means that you're helping somebody to gain their best version of themselves. Okay, thank you very much.